Hello, beautiful people. I'm Dr. Schwarzburg, founder and medical director at Skinly Aesthetics, right here on the Upper East Side in New York City. Welcome to my clinic. Welcome back to Skinly, beautiful people, and today we're going to talk about liquid facelift. Liquid facelift is my signature technique that involves targeted placement of dermal fillers into the face to achieve non-surgical facelift results. Let's cover the basics. Liquid facelift involves augmentation of the upper, mid, and lower face to achieve surgical-like results. The age range for this procedure is anywhere from early 30s to late 70s. This is how impressive this procedure is. As long as you have minimal to mild laxity in the upper, middle, and lower face, you're a great candidate with absolutely fantastic and outstanding results. A true aging process involves ligamentous laxity. So until that happens, non-surgical approaches are the best to restore facial contours. What are the typical signs of aging that make you the best candidate for this procedure? So in the absence of severe ligamentous laxity, those signs of aging manifest themselves by hollow under eyes, flat cheeks, shriveled appearance of the lips, and decreased definition of the jawline. So the major concern that most of my patients who come to see me for liquid facelift is that they are going to look unnatural because they will be over-injected. So what does over-injected mean? Over-injected means swollen cheeks, swollen under eyes, pillow face look, unnatural appearance, and all of those things are totally avoided with this procedure. Why? Because all we do is replenish what you have lost. Yes, it is possible to over-inject, but this is where my craft, my experience, my visual aesthetics, the way that I inject, all comes into play to ensure that all you get with this procedure is to replenish and restore what you have lost, and we're not adding anything else. All we do is essentially adding lost volume. The beauty of this procedure is that it takes as little as 30 minutes and at most 60 minutes. So think about it. In half an hour to an hour, you can walk out of the clinic with a totally rejuvenated face with 5 to 10 years taken off your face, looking very natural, not overdone, and just enhanced with replenished volume that looks beautiful. Another important feature of this procedure is the longevity of the results. Most of the dermal fillers that we utilize in the clinic last anywhere from 9 to 18 months, and that is a great investment because as the fillers dissolve, there is always a small residual that is left. So even if you do this procedure only once, it will never go back to your baseline, and you will always have the enhanced features that were originally present. Most of the patients come for touch-up every 12 to 24 months. So that allows you, from a financial perspective, to keep your budget in place, but at the same time, continue to look your very best. So how many fillers are needed to achieve the best outcomes? So the minimal number of fillers that I usually use during this procedure is 4, but the range is actually 4 to 10. So 4 to 10 fillers, that should be the expectation for this procedure. All right guys, so injecting 4 to 10 fillers may sound like a lot, but let's just go back to science for a second and let me explain to you the essence of dermal fillers. Most of the fillers that I use for liquid facelift contain hyaluronic acid, so they're hyaluronic acid based fillers. Hyaluronic acid is this natural sugar-like molecule that attracts water and expands in volume under the skin, anywhere from 2 to 3 times its size in the syringe. So 1 milliliter of hyaluronic acid in the syringe, it literally occupies about a half or a quarter of a teaspoon. The point is that 1 syringe of hyaluronic acid filler is actually not a lot. And the volume that we lose as we age is much more significant. So for you to have this scary peel of face appearance, may need anywhere from 10 to 20 fillers. And extremely important point that again I want to make is that as a physician, I have to understand the properties of different fillers. They're not the same. We have so many different fillers on the market, and to me as a physician, I must understand how they all react, not only on their own, but in specific patients, because every single patient is different. There are certain patients that when they have the fillers injected, expand more than others, while there are patients who respond less favorably and they achieve less volume with injections. Another thing to keep in mind is the age at which the injections are done. Somebody who is 20 years old who wants to augment their cheeks may only need 1 to 2 fillers. But if you are presenting to me at a slightly older stage in your life, you may have lost 5 to 6 cc's of volume, and that would require 3 to 4 syringes to just replace the volume. Again, we're not talking about augmentation, just replacing the volume. Replacing the volume in the cheeks of an older individual may take anywhere from 3 to 5 syringes without having any detrimental side effects. A lot of patients ask me before the procedure, what do they do if they don't like the results? Well, luckily, hyaluronic acid-based fillers are totally reversible with an enzyme called hyaluronidase. I use a specific brand called Hylenex. This is the best dissolving agent, and that allows me to literally melt all the fillers almost instantaneously. In reality, it takes 24 hours for all the filler to dissolve. It is also super important to note that Hylenex does not dissolve your own tissues. This is one of the most common things that patients come to me, and this is the most common question they ask me about dissolving any of the fillers. Every patient, literally 99% of the patients, they read online that Hylenex dissolves your own tissues. I want to stress this point one more time, that it does not, because there is no free floating hyaluronic acid in your body. All hyaluronic acid is contained within cells. I've dissolved numerous fillers over the decade, and I can confidently say that contrary to what you can find online, I have not seen any of my patients lose their own tissue with dissolving hyaluronic acid fillers. I've been practicing for over 10 years, and during this time, I developed and refined my techniques. I came up with a lot of unique approaches to augmentation, with fillers, with skin resurfacing with lasers, and those techniques deliver the best and most precise results. Moreover, precision is good, but without artistry, all those results don't matter much. So that is why over those 10 years, I've really honed my craft to deliver results that are both precise and artistic. When you guys come to Skinly, the first thing that you do is sit down with me to create a tailored plan. I do not employ one-size-fits-all approach. I really listen to all your beauty goals, everything that you want to achieve, and then together we create a great plan to make you look your very best. My primary goal when you come to Skinly Aesthetics is to enhance your natural beauty. I do not want to change you. I just want to make the best version of you with minimal enhancements, with all the tools that I have at my disposal. When you come to see me at Skinly Aesthetics, I will blend my expertise, my craft, my unique approaches with your unique goals, your aspirations, your dreams to create the best possible outcomes for the most natural looking, amazing results.